Shortly before after my 40th birthday, I got in a car and merged onto the highway on the way to work. And suddenly my heart was pounding and my chest was tight and I couldn't breathe. So I pulled off to the side of the road. I made a quick phone call to my wife, Sherry, and left her a brief message that I loved her. And then I called 911. A short time later, the paramedics arrived and they loaded me onto the ambulance. And they put nitroglycerin under my tongue. Nitroglycerin. I thought, wow, they must think I'm dying too. So they loaded me into the ambulance and they took me to the local emergency room. The emergency room doctor there ran a number of tests and she came back and said to me, not really sure what's going on with you, but you don't seem to be in any immediate danger. And so I was discharged from the hospital with a number of referrals for follow-up. And so then over the next several weeks, I saw a variety of specialists, received a variety of diagnoses, was started on a variety of medications to treat everything from heart disease to acid reflux. And then, a couple months later, it happened again. But this time I was able to immediately get in to see my longtime doctor. So he sat me down and he said, Tom, look, there is nothing wrong with your heart. What's going on with you? And after a conversation about everything that was going on in my life in that time, he gave me the correct diagnosis of having depression and anxiety. And it was manifesting itself in these terrible anxiety attacks that were making me feel like I was dying. I was really lucky. I'm a mental health professional. I went to my medical provider thinking I had a medical condition, but he saw the larger picture. He saw me as a whole person, and he was able to identify what I was facing were challenges related to my mental and emotional well-being. Unfortunately, this is not the norm in our country. The medical, mental health, and addiction treatment systems are existing in these separate silos, and they're creating this fragmented, difficult-to-navigate maze, a game of hide and seek, in order to find the care that one really needs. This leads to overly narrow diagnoses, and at times really bad outcomes for folks, where they end up in emergency rooms, hospital beds, and other institutional settings at the highest cost and likely the least effective treatment in the long run. So to see how this plays out in real life, let's follow the story of Emma, who's in 4th grade. Emma's teacher expresses concerns that she's often absent-minded in the classroom, at times she's falling asleep, and she's making frequent visits to the school nurse with a variety of complaints of aches and pains. Emma takes her to the doctor. Her doctor, after a brief visit, gives her a diagnosis and sends her home, likely without having evaluated or treated all her needs. So how does that play out for Emma? Continued difficulty in the classroom, maybe getting in trouble at school, leading to tension at home, adding to the stress of whatever she's already trying to cope with? That's an example of how the fragmented healthcare system is failing us. But thankfully, this is changing. We're changing the way we're caring for people's mental and emotional well-being as well as their physical health. We're recognizing that mental health conditions and addictions are genuine health conditions, just like heart disease or diabetes. And this shift is laying the platform to move away from this fragmented system to one that is more integrated and treats the whole person. It's leading to integrated care experiences. So how would this change for Emma? Emma's mom takes her to the doctor. The doctor now realizes, wait a second, there's more going on here than just a physical illness. Emma and her mom are able to go down the hallway and make an appointment with a social worker, one that specializes in working with kids. And that social worker is able to take the time to make a full assessment of all of Emma's needs. Now, the social worker, the doctor, Emma, and her mom are able to work together to create a care plan that addresses all those needs. This is an example of how an integrated care approach can be transformational in the lives of those that we serve. There's another innovation I want to share with you. It's the growing recognition in the healthcare system that unless one's basic needs are met, good overall health is very difficult to achieve. We refer to this as the social determinants of health. You may be familiar with Maslow's hierarchy of needs. Developed by Abraham Maslow, this well-accepted theory maintains that unless one's basic needs are met, it's hard to achieve those higher level goals and aspirations in your life. The social determinants of health is a similar theory that maintains that unless one's basic needs are met, good overall health, again, is very difficult to achieve. Simply put, it means that if people don't have a decent, affordable place to live, access to adequate amounts of nutritional food, and other basic needs met, all the best care in the world may not make a difference. What if Emma and her mom are living in a homeless shelter or in their car? What are the medical and behavioral health providers supposed to do about that? I'll tell you what. Increasingly, medical providers and behavioral health providers are partnering together with social service providers in order to develop comprehensive care plans. I mean, now we're really getting it somewhere. Not only having Emma's medical and behavioral health needs met, but also her basic needs, and everybody working together as a team on her behalf. There's a movement going on around the country and here at home where medical providers are increasing their ability to identify and assess the behavioral health needs of those that come to them for care. Also, they're increasing their ability to provide treatment for those behavioral health needs. Coinciding with those changes are changes that are happening in the behavioral health system, where behavioral health providers are increasing their ability to recognize the medical conditions of those that come to them for behavioral health care. And they're increasing their ability to treat those needs, either within their own practices or in partnerships with other medical providers. And so you can begin to see we're trying to aspire to create this no wrong door system in order to get the care that's required for your whole person. It's estimated by the American Psychiatric Association that 1/3 of all adults that are receiving medical care also have a behavioral health condition, such as depression or anxiety. If there are 300 of us here today, that means 100 of us are facing these challenges. 1/3 of the neighbors in your neighborhood, 1/3 of the students in our schools. Additionally, 70% of people who are receiving behavioral health care also have a coinciding medical condition. So this can range from persistent headaches to insomnia to more chronic conditions such as diabetes. And guess what? An integrated care approach will not cost more money. In fact, we think it will not only dramatically improve care, but it will do so at a lower cost. It's estimated that an integrated care approach will save commercial insurers, Medicaid and Medicare, $26 to $48 billion a year just in our country alone. How is this possible? Well, it's possible because when people get all the care they need, when they need it, in the communities in which they live, they're able to avoid those higher cost stays in emergency rooms and hospital beds and other institutional settings, again, likely at the least effective care for them in the long run. We can do so much better for those of us that have heart disease and also suffer from depression. And we can do so much better for those of us that face mental health challenges and need specialized assistance in order to care for conditions such as diabetes. And we sure don't need nitroglycerin to be put under our tongue to know that now is the time to begin to make these changes. We can begin to work together as a community, asking individuals to join in together with us in order to face these issues, not just alone, but together, core issues that we face in our community, such as chronic homelessness, addiction, and mental illness. For example, in the city of Everett, the city is partnering with law enforcement, medical providers, mental health providers, addiction treatment providers, low-income housing providers, and social service providers in order to create comprehensive care plans to help the chronic homeless in our community. All of us bringing our expertise to the table and developing holistic care plans one by one to help these communities rise up off of the streets, get a place to live, get a job, and rejoin us as community members. If you know someone that could benefit from an integrated care approach, would you suggest a resource? Because they do exist. The Everett Clinic, for example, provides behavioral health treatment to those to whom they also provide medical care. And at Compass Health, we are beginning to more and more provide medical care to those that come to us for behavioral health care. We don't have to stay stuck in this system that isolates us from the care that we need. And we can imagine and we can envision what it would begin to look like if integrated whole person care were widely practiced in our communities. People who are frozen in their situation, having their suffering eased, and regaining their lives of emotional richness. Again, the homeless, having all the systems come together and approaching them with a whole person care approach that really allows them the best opportunity possible to get off the streets, get into treatment, get a place to live, and begin that road of recovery to a life that's full of purpose. Parents who are ill and addicted, getting their suffering eased so that they can be the parents that their children need them to be, to move beyond the hopelessness, despair, and anger, and regain the confidence and enthusiasm to raise their kids. I think this is our best shot at attacking the opioid crisis both across the country and here at home. So many people with opioid addictions have everything going on. They have medical challenges, addiction challenges, mental health challenges, basic need challenges. And unless we come together and bring forward an approach that addresses all those needs, I don't think we're going to make any progress in terms of helping them as an individual or in attacking the problem as a whole. A friend of mine told me about an experience that some have when they're receiving treatment for AIDS. It's called the Lazarus effect. And in the treatment process, they move from being frail skeletons, and then they rise up out of that process, the perfect pictures of health. I've seen this happen at Compass Health. People come to us and they're at the end of their rope. They don't have a home, they're ill, they have mental health challenges, they have addictions, and they don't have any hope. But when we're able to embrace them as a whole person, we give them that best opportunity to raise them up and have that experience to regain lives that are full of recovery and purpose. And so I ask that you would join me in shaping and sharing a new future of health that treats the whole person and gives all of us the best opportunity to live lives that are full of good health and happiness. Thank you. Thank you.